Hi everyone, here's some vaccine news you can use. As you can see here, community transmission of COVID-19 has been increasing over the past 2 weeks, likely due to a combination of post-Thanksgiving cases, but also likely due to the arrival of the Omicron variant. While Delta appears to continue to be the dominant variant, we expect Omicron to spread locally, with the first case in Illinois being identified in Chicago this week. The 7-day rolling average of COVID cases per day is in the very high transmission range, while the percent positivity is increasing, currently at 4.2%, and still in the lower transmission category. We expect these measures to increase, unfortunately, over the next few weeks. Here you can see the very sharp increase in cases over the past 2 weeks, which is even sharper than some of our other peaks. Over a period of 1 week, as of December 9th, we've seen identification of the Omicron variant in 25 states in the U.S. and 57 countries worldwide. So how can we fight this new variant? Preliminary data shows that boosters may give our neutralizing antibodies enough to make disease less severe, and the mutations found in the Omicron spike protein may not impact the longer-term cell-mediated or T-cell immune response. This gives us something to focus on locally, along with promotion of all the mitigation measures that we have come to know and love. So make sure to remind your patients, especially to avoid high-risk environments over the holidays, and try to reduce missed opportunities in your office for primary series and booster vaccination. We'll talk more about what we know so far about Omicron and reduced vaccine efficacy in the next video. In the meantime, let's look at our most recent local vaccination coverage. With over 3.8 million Chicagoans vaccinated with at least 1 dose of vaccine as of December 8th, we have a lot to be proud of. And this is coming up on the anniversary of the first COVID-19 vaccine given in the U.S. on December 14th of last year, and right here in Chicago on December 15th. We're also very happy to see that vaccine administration is back up to over 100,000 doses per week, which is the highest we've seen since May, with a greater diversity of outpatient providers. This is hopefully due to increased vaccination of 5 to 11-year-olds, since we saw a nice bump in November. But with over 200,000 kids this age to vaccinate, we still have a lot of work ahead to keep kids safe during winter break. Over 439,000 Chicagoans have received a booster dose as of December 8th, at volumes that certainly bounced back over Thanksgiving, as you can see here. And we've heard anecdotally that there is increased demand across the city and in our own clinics in response to the news of the Omicron variant. Here you see that just over half of 65 plus, over 1/3 of 50 plus, and over 1/4 of our 18 plus population has received a booster, which is slightly higher than current U.S. coverage. This data is as of 12/8, and the count of people who received a booster dose includes anyone who's fully vaccinated and has received another dose of COVID vaccine since August 13th, 2021. This includes people who received booster doses and people who received additional doses. Interestingly, while higher in older age groups, which we'd expect, when you look at a breakdown by race ethnicity, you find that booster uptake has been lowest among adult Latinx Chicagoans who are due for a booster. Help us promote vaccine equity by improving vaccine access, as well as direct messaging and outreach to this group. We also cannot forget about the importance of primary series vaccination, since our Black non-Latinx 65 plus population continues to bear the brunt of our recent increase in hospitalizations and deaths. In our contact tracing, while safety continues to be the concern among most unvaccinated contacts, we're hearing some indications that older Black adults are worried about the vaccine interfering with their pre-existing medical conditions on the advice of their providers. Please contact us if you have concerns about a particular patient so we can put some of these rumors to rest. On December 9th, CDC expanded its booster recommendation to include 16 to 17-year-olds. They stated in a media statement, Although we don't have all the answers on the Omicron variant, initial data suggests that COVID-19 boosters help broaden and strengthen the protection against Omicron and other variants. So Pfizer will be introducing a pre-diluted gray top vaccine product towards the end of December. This will help make it easier for offices to offer booster doses. Key points for now include the following. While the dose volume and the number of doses per vial is similar to the purple top 12 plus product, the storage and handling is identical to the orange top pediatric product, and this is because they both use the same buffer, the tris sucrose buffer, compared to the purple top. We'll have many more trainings for you on the details of how storage, handling, and prep differ between these formulations, such as a different appearance during mixing shown here of the gray top. In these times when vaccine counseling and information from trusted clinicians is needed more than ever in a pandemic that seems to never end, please refresh your practices about the CMS and local HFS guidelines about receiving reimbursement for vaccine counseling, and this is for patients up to the age of 21 years. CMS is requiring states to cover COVID-19 vaccine counseling visits. They'll match COVID-19 vaccine counseling only visits at the ARP 100% federal match rate only when they are provided to children and youth under the age of 21 as part of the Medicaid early and periodic screening, diagnostic, and treatment benefit. More detailed information is available on this slide on the Illinois HFS website. Remember that you have a sympathetic ear from other providers on the ground, and we are all feeling vaccination recommendation fatigue. Watch this short but impactful video to get yourself back in the zone. We continue to have a lot to fight for. Boosters for everyone over 16, continuing pediatric vaccination for school-age children, and not missing opportunities for primary series initiation for those at highest risk. Thanks for listening, and happy holidays.